Welcome back to CareFlow Academy. Thanks for joining me today. In today's lesson, we're going to make respiratory disorders much easier. Just like we did with electrolytes, we're going to stop memorizing random symptoms and start recognizing patterns. Because once you understand what's actually happening inside the body, NCLEX questions become much easier to answer. Today we'll be covering asthma, COPD, pneumonia, and pulmonary embolisms. We'll also walk through practice questions and use the C.A.R.E method to break down exactly how to think through respiratory questions on the NCLEX. So grab your notebook, get comfortable, and let's get started. Let's start with an important question. Why do respiratory questions feel so difficult? For many students, it's because they try to memorize every symptom for every respiratory disease. One disease has wheezing, and another has crackles or chest pain and coughing. Before long, everything starts blending together. Instead of memorizing symptoms, I want you to understand what's actually going wrong inside the lungs. Once you recognize the underlying problem, you can start predicting what signs and symptoms you should expect to see. That approach is much more reliable than trying to memorize dozens of separate symptom lists. We don't want to learn respiratory disorders as isolated facts. We want to connect the disease process to the assessment findings, the interventions, and the priorities that follow. And that's exactly what we're going to practice today. Here's the secret to respiratory disorders. Each respiratory condition has a primary problem. If you identify that problem, many of the symptoms and nursing interventions become predictable. Let's look at our 4 shortcuts. When we see asthma, I want us to think of airway. If we see COPD, that means that air can't get out. Pneumonia tells us that oxygen can't cross over. And a patient with a pulmonary embolism, think blood can't reach. That's it. Those are the 4 patterns we're going to build this entire lesson around. Instead of memorizing diseases, focus on the underlying problem. Understand the problem, and the symptoms become much easier to recognize. Now let's take it one step further. Every respiratory disorder has a priority safety concern, and the NCLEX loves asking questions about safety and priorities. If you know the disorder, you can often predict which body system is most at risk. Asthma is primarily an airway problem, so our safety concern is the airway. COPD is primarily a breathing problem, so our focus becomes ventilation and breathing. Pneumonia interferes with oxygen moving into the bloodstream, so our priority becomes oxygenation. Pulmonary embolisms interfere with blood flow through the lungs, so our priority becomes circulation. Notice how each disorder points us toward a different safety concern. This is exactly how nurses prioritize care in the real world. Match the disorder to the body system most at risk, and many NCLEX priority questions become much easier to answer. Now that we understand the big picture, let's start breaking down each disorder one by one. Let's begin with asthma. Asthma is one of the most common respiratory conditions you'll see on the NCLEX. And thankfully, it's one of the easiest to recognize once you know the pattern. Remember our shortcut? Asthma means air can't get in. When a patient experiences an asthma attack, the airways become inflamed and narrowed. The muscles surrounding the airways tighten, mucus production increases, and airflow becomes restricted. That's why patients often feel like they're trying to breathe through a straw. Common NCLEX clues include wheezing, chest tightness, shortness of breath, and exposure to a trigger. The trigger may be pollen, dust, or dander. Whatever their allergy is, the presence of a trigger is often the clue that helps identify asthma. When you see wheezing plus a trigger, your asthma alarm should start going off. And remember the priority. Open the airway. Next, let's talk about COPD. COPD is different from asthma because the problem isn't getting air into the lungs. The problem is getting air out. Remember our shortcut. COPD means air can't get out. Over time, damage to the lungs causes air to become trapped inside. The patient can inhale, but exhaling becomes much more difficult. That's why you'll often see prolonged expiration, pursed lip breathing, a barrel chest, or a long history of smoking. The body is trying to find ways to push trapped air out of the lungs. That's why pursed lip breathing is such an important clue. It helps keep the airways open longer and improves exhalation. When you see COPD, think ventilation, and help the patient get air out. Now let's move on to pneumonia. Pneumonia has a completely different problem. Remember our shortcut, oxygen can't cross. With pneumonia, infection causes fluid and inflammation to fill parts of the lungs. The airway may still be open, and air may still be moving in and out, but oxygen now has difficulty crossing into the bloodstream. That's why patients often develop low oxygen saturations, crackles, fever, and a productive cough. The lungs are filled with fluid, making oxygen exchange less effective. So, when you see pneumonia, your priority should be oxygenation and helping oxygen cross into the bloodstream. Our final respiratory disorder is pulmonary embolism. And this is one of the most important emergency conditions you'll see on the NCLEX. Remember our shortcut, blood can't reach. A pulmonary embolism occurs when a blood clot travels through the bloodstream and becomes lodged in the pulmonary arteries. The airway may be open and the lungs may be functioning, but blood can no longer effectively reach portions of the lung. Without blood flow, oxygen exchange becomes impaired. That's why pulmonary embolisms often present suddenly. Patients may begin to have sudden shortness of breath, sudden chest pain, sudden anxiety, and tachycardia. The word sudden is often one of the biggest clues on the NCLEX, especially when combined with recent surgery or immobility. Those situations increase the risk of blood clot formation. And when blood can't reach the lungs, circulation becomes our priority. Now that we've learned the 4 major respiratory patterns, let's see how they show up in NCLEX-style questions. Let's go ahead and practice what we've just learned. A patient suddenly develops chest pain and shortness of breath 2 days after hip surgery. Which condition should the nurse suspect? Is it A, asthma, B, COPD, C, pneumonia, or D, pulmonary embolism? Let's go ahead and break down this question using our C.A.R.E method. Let's start with the concept. The NCLEX is testing whether we can recognize a sudden respiratory emergency and identify the most immediate safety concern. When you see clues like sudden shortness of breath, sudden chest pain, recent surgery, immobility, or an unexplained change in respiratory status, your brain should immediately begin asking what physiological process may have been disrupted. Notice that we haven't chosen an answer yet. Instead, we're focusing on the pattern hidden within the question. Ask yourself, did the symptoms occur suddenly? Is blood effectively reaching the lungs? Which ABC priority may be threatened? Once we answer those questions, the correct answer often becomes much easier to find. Now, let's analyze the question. The biggest clue is the word suddenly. The patient suddenly develops chest pain. The patient suddenly develops shortness of breath. And these symptoms occur only 2 days after hip surgery. Hip surgery increases the risk of blood clot formation because patients are often less mobile during recovery. If a clot forms in the leg and breaks loose, it can travel to the lungs and become a pulmonary embolism. This is why recent surgery is such a huge NCLEX clue. Think, recent surgery plus sudden symptoms equals pulmonary embolism until proven otherwise. Now let's rule out our answers. Choice A, asthma, is usually associated with airway narrowing. We would expect wheezing. We would also expect a trigger such as pollen, dust, or pet exposure. Those clues aren't present here. Next is COPD. COPD is a chronic disease. It develops gradually over years. COPD does not usually appear suddenly out of nowhere. That doesn't fit our scenario. Now let's look at pneumonia. Pneumonia is an infection. We would expect symptoms like fever, productive cough, crackles, and a more gradual onset. None of those clues are provided. That leaves pulmonary embolism. Recent surgery, sudden chest pain, sudden shortness of breath. Every clue points directly to pulmonary embolism. And finally, let's execute. The nurse should suspect a pulmonary embolism. This is a medical emergency because blood flow through the lungs is being obstructed. Without adequate blood flow, oxygenation can rapidly decline. The correct answer is D, pulmonary embolism. Remember this NCLEX shortcut. Recent surgery, sudden chest pain, or sudden shortness of breath, think pulmonary embolism. Let's try another one. A patient with COPD has an O2 saturation of 88%. What is the priority nursing action? Is it A, increase oxygen to 100%? B, encourage pursed lip breathing? C, restrict fluids? Or D, place the patient flat in bed? Let's go ahead and break this question down. Let's begin with the concept. The NCLEX is testing your ability to identify a patient's primary respiratory problem and determine the safest nursing priority. When you see a respiratory question, don't immediately focus on the diagnosis. Instead, focus on what is preventing effective breathing. Ask yourself, is this an airway problem, a ventilation problem, an oxygenation problem, or is this a circulation problem? The NCLEX loves rewarding nurses who identify the physiological problem before selecting an intervention. Once we understand the problem, choosing the best action becomes much easier. Now, let's analyze the question. The patient has COPD, and the patient's oxygen saturation is 88%. Many students immediately focus on the oxygen number, but remember what I always say. Treat the patient, not the number. COPD patients often live with oxygen saturations that are lower than those of healthy individuals. The bigger problem is that air is becoming trapped inside the lungs. If air can't get out, fresh oxygen-rich air can't easily get in. Think, air trapping equals ventilation problem. Now, let's rule out our choices. Let's start with D, place the patient flat in bed. This would actually make breathing more difficult. Patients with respiratory distress usually breathe better sitting upright. Next is C, restrict fluids. This does nothing to address our patient's immediate concern to ventilate. Now, let's look at A, increasing oxygen to 100%. This sounds tempting because the oxygen saturation is low. But remember, this question is asking for the priority action. The underlying problem is air trapping. Oxygen alone doesn't fix trapped air. That leaves B, encourage pursed lip breathing. Now we can execute. Pursed lip breathing helps keep the airways open longer during exhalation. This allows more trapped air to leave the lungs. Better exhalation means better ventilation, and better ventilation means improved oxygenation. The correct answer is B, encourage pursed lip breathing. Remember this NCLEX shortcut. With asthma, the air can't get in, and with COPD, the air can't get out. Let's work through one more question. A patient with asthma develops severe wheezing and shortness of breath after exposure to cat dander. What is the priority action? Is it A, administer a bronchodilator, B, encourage coughing, C, restrict fluids, or D, obtain a sputum sample? Let's break this question down using our CARE method. Let's start with the concept. This is testing our ability to identify an airway emergency and determine the priority intervention. When you see clues such as wheezing, chest tightness, trigger exposure, or shortness of breath, immediately begin thinking about whether airflow through the airways is becoming restricted. Remember, we're not looking for the diagnosis yet. We're trying to understand what problem the patient is experiencing. Ask yourself, which intervention directly improves airflow? Once we identify the underlying problem, the correct intervention becomes much easier to recognize. Now, let's analyze the question. The patient develops symptoms after exposure to cat dander. That is a classic allergy trigger. The patient is also wheezing and experiencing shortness of breath. Together, these clues indicate bronchospasm and airway narrowing. Think, trigger plus wheezing equals asthma exacerbation. So immediately, we should begin to look for choices that will help bring O2 into the lungs. Now, let's rule out our answers. Let's rank our interventions from first to last. Let's start with B, encouraging coughing. Coughing may help clear secretions, but secretions are not the primary problem. The airway is narrowing. Next is C, restrict fluids. This does not improve airflow, and it does not address the patient's immediate problem. And finally, D, collecting a specimen may provide information later, but it does not help the patient breathe right now. Let's go ahead and execute. Bronchodilators relax airway smooth muscle. The airway opens, airflow improves, and the patient's breathing becomes easier. That makes this our priority action. The correct answer is A, administer bronchodilator. Remember, asthma means air can't get in, so open the airway first. Notice how the other choices weren't incorrect for respiratory patients, they were just not appropriate for our asthma patient. The other answers would still benefit patients with other respiratory issues. That's why it's important to first match the disorder with the system being affected. Before we finish, let's bring everything together one last time. Remember, don't memorize diseases. Understand the problem. Asthma is an airway problem. COPD is a ventilation problem. Pneumonia is an oxygenation problem. And pulmonary embolism is a circulation problem. When you understand what's happening inside the lungs, the symptoms begin to make sense. The priorities begin to make sense. And now that difficult question is easier to break down. And the questions become much easier to answer. Remember, you've already come so far. Think of what you knew in your first nursing class and think about how much more you now know. You've got this. Keep practicing. Thank you so much for joining me today. I hope this module helped make respiratory disorders feel a little less overwhelming and a lot more manageable. Remember, when you understand what problem is occurring inside the lungs, the symptoms, interventions, and NCLEX questions begin to make much more sense. Keep practicing the CARE method, trust the process, and continue building your clinical thinking skills, one question at a time. In our next module, we'll move into cardiovascular disorders and learn how to recognize some of the most commonly tested cardiac conditions on the NCLEX. Thank you again for spending this time with me and for being part of our CareFlow community. Just remember to take a deep breath and keep telling yourself, you've got this. You've come so far, we're nearly there. Don't forget to take care of yourself, and I'll see you in the next one.